Medical experts like Dr. Fauci say a positivity rate of around 1% means you have a good handle on the virus. If it's 5% or higher, you have a problem. State officials often tout our low rate, but with recent events, some are wondering if the state's estimate is giving the full picture.
Most communities have been successful in stopping the spread of the virus by making changes to their daily behavior.
That's Governor Baker at the end of September congratulating the state for efforts to fight COVID-19.
The 7-day average for the statewide positive test rate has been at 0.9% for the past 4 consecutive days. That's one of the lowest positive test rates in the U.S.
2 weeks earlier,
the state's positive test rate has now dropped the 7-day average to 0.8%.
And earlier this week,
the 7-day average positive test rate remains at about 1.1%.
The governor and DPH have made it clear the positive test rate, along with testing capacity and hospitalization numbers, will guide our reopening. Take a look. That positivity rate we keep hearing about has remained relatively steady from the end of August to now, under 1% more than 30 consecutive days. Even as the number of communities moving into the red infection zone increased from about a dozen to 40. And that has viewers, even some medical professionals, questioning that statewide positivity rate.
Really what that's telling us is how much testing we're doing in the community. I question its value in terms of actually measuring how much infection there is in the community.
The rate of infection the state emphasizes is calculated this way: a rolling average of the number of new positive cases divided by total number of tests given. But Dr. Stephen Kistler of Harvard's Chan School of Public Health says that can be somewhat misleading because the total tests include repeat tests. There's been a massive increase in tests given at colleges and other facilities for the purpose of surveillance. They're given over and over to the same people, sometimes accounting for more than 70% of the daily test totals. And most of those tests are expected to be negative.
So that really expands this denominator, the number that you're dividing by, and in a way can dilute the prevalence in the population because you're repeatedly testing people who are very unlikely to be infected. And so then effectively what that does is that removes your ability to see potential increases in prevalence because you have so many people just sort of flooding the system with their tests.
Kistler says that could be why we see a mostly unchanged rate around only 1%, even as there is clear evidence the rate of infection is growing.
I think the most important thing when looking at that front-facing statistic is to recognize that just because of how we're doing testing, it's an undercount, and the positivity rate is likely to be higher.
There is another way to calculate it, the same way the state was doing it until this summer. Only include tests given to new people, removing those repeats from the total tests. Calculated that way, and the rate has been climbing since late August, now around 4%, seeming to better capture that increase we've been seeing with COVID-19 cases.
It's just easier to interpret. I think it gives us a better sense of actually how many people are infected rather than how robust our testing capacity is.
5 Investigates learned the state changed its calculation method this summer to be more in line with other states that can't track testing in such a detailed way. Now, the Department of Public Health tells us they use many data points to guide policy, not just positivity. Karen Anderson, 5 Investigates.